All right. I hope you enjoyed the first series. Okay. And the second series. This is series number 3. Okay. On removable partial dentures. For those of you who have sent me questions, I have already replied. So make sure you check your emails for replies. Okay. All right. Okay. So let's move on. Let's see. All right. So this is question number 12, which states the metal framework workup is done on what cast? Okay. The metal framework workup is done on what cast? Okay. Is the workup done on diagnostic cast, the final cast, altered cast, or all the above? Okay. So our answer here is B. All right. The metal framework is done on the final cast. Metal framework WhatsApp. Okay. All right. So make sure you review the metal framework WhatsApp for RPDs. And the question number 13, mastercast land area should be, how big should a mastercast land area be? So you have to know what the land area is. So a land area, so remember on the when you take impression and you pour the impression into stone, now you have the cast. So you have to trim. Remember you have an area of stone and then you have teeth here. Okay. So when you are trimming, how much should this area? This is called the land area. Okay, when you trim the cast. So how thick should that area be? Okay. So for example, this is your cast here. All right. This is a quick illustration. Okay. So and then your stone around. So your land area, how thick should it be? Okay. So your land area should be about 3 to 5 millimeters. Okay. So 3 to 5 millimeters, which is C. Okay. All right. Question number 14. Your favorite patient presents for replacement of missing teeth in the mandible. Your evaluation reveals the patient has periodontally weak teeth with only remaining teeth number 22, 23, 24, 25, 26, 27. So he has the mandibular teeth from canine to canine. Okay. That's so what Kennedy classification is this patient? So the patient has 22, okay, 22, 23, 24, 25, 26, 27. So that means here there's space here, missing teeth in the back. So this is Kennedy class 1, right? So our patient here is a Kennedy class 1, but they have periodontally compromised teeth, right? So what kind of major connector are we going to give this patient? Are we going to use the lingo plate? Are we going to use the lingo bar? In the previous series, we have already reviewed the lingo bar. Are we going to use the labial bar? Labial bar is very rare. Or are we going to use a continuous bar retainer? So you have to know, in a periodontally compromised patient, you need to use something which is going to make the teeth stable, and that is the lingo plate. So our answer is A. Okay, so A is our answer. Now let's review some indications of the lingo plate major connector. Okay, so the lingual plate major connector is used when there are 6 or less anterior teeth. The lingual plate major connector, okay, is used when there are 6 or less anterior teeth, and when the remaining teeth are periodontally weak, and when there is poor tolerance for the lingual bar. So if a patient cannot tolerate a lingual bar, then you need to put a lingual plate as a major connector. If there's possibility of future addition of teeth to an RPD, if you plan to add some teeth on the RPD, then a lingual plate is good because you have a chance of adding some acrylic on the lingual plate and add some teeth if the patient ends up missing some anterior teeth. However, if you use the lingual bar, then you have to remake the entire RPD. Okay. Also, the other indication is if the patient had a previous experience with the apron connector. Okay. If the patient has less than, remember when we reviewed the indication for the lingual bar? Now here we're discussing about the lingual plate. If the distance from the gingival marginal, the gingival margin or the gingival sulcus is less than 7 millimeters, the distance from the gingival margin to the floor of the mouth is less than 7 millimeters, then you want to use the lingual plate. If the patient has a lingual tori, okay, and then you can use a lingual plate instead of the lingual bar. And if you want stabilization of periodontally involved teeth, okay, so make sure you review indications of the lingual plate versus the lingual bar. Okay, so if you look at the previous series, we have already discussed this about the lingual bar. Now this is the lingual plate. The contraindications for lingual plate, okay, major connector, is if there is increased coverage of soft tissue and hard tissues, then don't use lingual plate. If the patient dislikes the coverage, because the lingual plate is going to cover the soft tissues, okay? And if there's a possibility of creating periodontal problems, if made improperly, if you make a mistake and introduce periodontal issues, then that's a possibility of avoiding a lingual plate. Okay? And if there is severe crowding of teeth, then the lingual plate is not possible. Okay? So make sure you know the indications and contraindications. Let's move on. So question 15. Okay. What house classification is a patient who is easygoing, congenial, mentally well adjusted, cooperative, and confident in the skills of the practitioner? So this is your ideal patient that you want. Okay, you want the patient who is easygoing, congenial, mentally well adjusted. They come in happy. They like your skills. They don't question your skills. Okay, so so you have to know the house classifications. Okay, for your board reviews, you have to know your house classifications. Okay, so is this patient is this indifferent patient, or is it an exacting patient? Is this a hysterical patient? Is it a philosophical patient? Okay, so the answer, this is a philosophical patient. Okay, so our answer is D. So you have to make sure you know the house classification. All right, so house classification, the philosophical patient. A philosophical patient is easygoing, congenial, mentally well adjusted, cooperative, and confident in the skills of the dentist. And usually the prognosis, okay, prognosis of philosophical patient is excellent. So this is your ideal patient. Okay, so make sure you know House's classification of patients. Now, an exacting patient. Who is an exacting patient? An exacting patient is precise, intelligent. Sounds like most of us. Precise, intelligent, immaculate in dress and appearance. Okay? This is exacting patient. Often expresses dissatisfaction with past treatment. So they'll tell you why they didn't like the previous dentist. Okay? They may request written guarantee or remakes at no charge. Now, if an exacting patient is satisfied with your skills, they may become the practitioner's greatest supporter. So these are the people who say, "Oh, I was scared of dentists. Now I found the dentist that I like," and they send you all their referrals. Okay, but before you get to them, before they become accepting, they are very critical of your work. Okay, so exacting patient can be your worst nightmare or your best patient. Okay, all right. So a hysterical patient. Who is a hysterical patient? So a hysterical patient is has a negative attitude and submit to treatment as the last resort. So these are the people who wait last minute. Oh, the tooth has been hurting for a long time until it gets an abscess. That's when they come to you, or they don't go to dental clinics very often until now they have developed some periodontal issues. Okay, and they often appear. So a hysterical patient can appear as if they're exacting, okay, but they have complaints regarding previous treatments which are unfounded, okay. So they may say why they didn't like the previous dentist, but these complaints don't make sense at all, or uh, they have no foundation. And a hysterical patient may display, okay, unrealistic expectations. So somebody with periodontally compromised teeth and cavities coming in saying, "I want teeth whitening." That's the first thing they want. So then you know this is a hysterical patient. Okay? And then the next classification is an indifferent patient. Okay? So an indifferent patient is a patient who is not concerned with their appearance and often go without dentures for years. People who are they come in and you look in the teeth, they don't have teeth, and then you say, "Do you have dentures?" "No, I never got dentures." But they don't care. That's an indifferent patient. Okay? And they are non-persevering patients who do not adapt well. They have no desire to wear dentures and do not value the effort of the practitioner. So in the for your exams, for board reviews, make sure you know the house classification of patients. Okay, you need to know this classification. All right. Okay. All right. So we'll end here, and coming up next is going to be the removal partial denture review series number 4. Okay. If you haven't subscribed, make sure you click subscribe, and also make sure you click on the bell notification so that when the new videos are added, you get the notification that there are new videos available for you to review. Okay. All right. So if it's helping you, if this review is helping you, keep sending the questions, and also you can share with somebody, some of your colleagues who are also preparing for your exams. Okay. All right. Good luck.